Hi there, I'm integrative gastroenterologist, Dr. Robin Chatkan, and the founder of the Digestive Center for Wellness. I want to talk to you a little bit about my SIBO course. In order to successfully treat SIBO, it's really essential to understand that the overgrowth in SIBO happens because of depletion of essential bacterial species in your gut. SIBO is really a form of something we call dysbiosis, which really refers to bacterial imbalance in your microbiome. And there are really three phases to how dysbiosis develops. The first phase is what I just mentioned, is a reduction in the essential anaerobic species in your gut. And that's primarily things like bifidobacteria and lactobacillus, the normal, healthy, dominant species in your digestive tract. The second phase is colonization with more pathogenic bacterial species. So you start to see an increase in species like Campylobacter, Klebsiella, Staphylococcus, and of course, fungal organisms. In the third phase of dysbiosis, you start to see active reproduction of some of these sort of less healthy bacterial species. So as the levels of Campylobacter and Staph and Klebsiella and Candida increase, the levels of lactobacillus and bifidobacteria drop even further. But what leads to this whole process of microbial disruption in the first place? Well, the medicine cabinet is usually a pretty big contributor. So antibiotics, acid blockers, birth control pills, antidepressants, anti-anxiety medications. It's a pretty long list. Of course, diet plays a role too. Too much animal fat, too much animal protein, too much sugar, not enough plant fiber. And then of course, specific ingredients like artificial sweeteners can also wreak havoc on your microbiome. In the first half of the course, I'm really going to be focusing on this concept of microbial disruptors, identifying, figuring out how to mitigate the damage that these microbial disruptors do. And in the second half of the course, we're going to be focusing on therapeutics. Now, many, if not most of the patients who come to see me in my medical practice have been on an antibiotic to treat their SIBO. And when you think about it, it really doesn't make sense, right? The idea that an antibiotic could fix a problem that's caused by antibiotics, and that is indeed the case. So often when people are put on an antibiotic for SIBO, they feel better initially because the antibiotic sort of wipes out all the bacteria in the gut. So their gut is almost sterilized and their bloating improves and their abdominal discomfort improves and their gas improves and they feel great. But after a few weeks or after a few months, as the bacteria start to regrow, they end up regrowing in a similarly imbalanced way. And people end up right back where they started. So there really is no magical pill or cure. And I am definitely not here to promote any supplement or cure for your SIBO, but really focusing on repopulation can make a huge difference in creating real and lasting relief from SIBO. And that's what I'm here to tell you about, is the whole process of how this develops and what you can do to make it better. And again, it is this concept of sort of removing the factors that are contributing, replacing the essential species that have been lost, and restoring the health of your microbiome. I'm really excited to tell you all about it.